It's hard to follow that speech, but I will do my best. All right. So now let's dive a bit deeper into how this infrastructure really works. And I have a question for you. How many programmers does it take to cross the border? Exactly, none. Well, some, but not in the way you think. For millions of people to be able to cross the border, we need a multidisciplinary team. My job, when I'm not standing here talking to you, obviously, is to make sure that technology is transformed into solutions that work for the most vulnerable of us. In my experience as a user experience designer, I'm specialized in delivering services in the public space. I've seen a lot of Cinderella stories. You know the story. A lovely lady has lost a very beautiful and unnecessarily expensive shoe. And then the prince finds it and goes on a journey to find the person who fits that shoe. And after many attempts, they live happily ever after once they found each other. Now, the tragic thing about the Cinderella story is that many people had to suffer to try to fit in that shoe until the exact match was found. And for a long time, technology has done exactly that. We've developed shoes that did not fit the reality on the ground. And time again, in crisis situations, we grab what we have at hand and try to patch it up and make it fit realities that developers, engineers, or designers have never actually seen before. At the same time, we have seen a lot of response to any kind of situations, big or small crisis, being planned and deployed from a service perspective and not refugee-centric. Many times it's more about what we have to offer to them and less about what they actually need and when they need it and how they need it. Regardless of the angle you look at it, we keep looking at technology as a means to an end and not as an enabler. We're not yet ready to be digital by design in our intervention, and in many cases, the technology that we use is actually making things worse and making us actually more vulnerable. Poorly designed software can make things much worse. The reality is because we don't use technology strategically, we have so many blind spots that will soon be in the dark. And let me tell you a story. I'd like to tell you how our humanitarian infrastructure Bogdan was talking about earlier came to be. When the war in Ukraine started on 24th of February 2022, our team at Commit Global was just recovering after 2 long years of COVID intervention. It was 10:12 a.m., and a team member called and asked, when do we assemble? He actually meant to ask, when does the task force start? Task force is an internal mechanism for us that we deploy every time we're in a crisis. We know what we have to do. We had done it before. We had rehearsed it before. We had done it in the pandemic, and now we were doing it again. But we had never done it before in a war. In order for you to understand the space that this was happening in, this was taking place in Romania, simply by chance. But a country pretty much in the middle when it comes to everything, from public service quality, healthcare, education, you name it. And as you may guess, pretty far from sustainable digital transformation. We didn't have proper digital infrastructure, and definitely we had no clue on how to include digital in the response from the get-go. Also, nobody actually had real experience in civil society as well. None of our NGOs were humanitarian, and yet they had to be. In the first hour after the war started, we planned what we had to build and deploy. We brought the expert in the room. And by the expert, I do not mean the software architect, I don't mean the developer, I don't mean the designer. We brought the humanitarian expert. We understood the journey of every refugee moving forward, from the decision to leave the conflict area up to the point when they reach the Romanian border or the Moldovan or Polish one. We mapped the refugee journey, the refugee context, and the constraints and limitations that these journeys have. We identified the places where technology made sense to be used in this intervention, and we mapped the response that the country was getting ready for. We got in touch in a matter of hours with the Department for Emergency Situations, with the central government, with the UN agencies, and we got in touch with civil society who was already on the ground going to man the borders. Having both of these journeys side by side, we connected the two, and most importantly, we overlapped the threats for each of them. And then we had the ecosystem. It took us 48 hours to set up a single multilingual entry point for every single refugee or first responder to access, where they can find all the information they need: documents, services, aid, verified housing, medical care, and much more. But this wasn't just one other platform among hundreds of others. For the first time, we had one platform. We brought together an unprecedented coalition of actors: the government, the UN agencies, civil society, all speaking with one single voice on one single platform, putting together all their communications capacity behind it. And then we had a shared infrastructure, saving time, saving funding, saving maintenance efforts, and enhancing the outreach capacity in seconds. Having this single source of official information has also helped refugees gain trust that the information is reliable, verified, provided by experts. We made it accessible, flexible, easy to reach and available 100% of the time. We made it trustworthy. The second step was to ensure the proper aid infrastructure. And in 7 days since the war started, we had 2 complex platforms ensuring access to housing and all other types of resources. The shelter and aid managers have been designed together with experts in humanitarian assistance, authorities, and anti-trafficking CSOs, so we can understand how we can make sure that whatever resource or whatever space is provided to refugees is away from threats. I was telling you about the aid management. Information is great. Information is essential in these times of crisis. Providing information in a timely manner for as many people as possible also takes the burden off the first responders. You'll get less calls on the emergency services. You'll get less questions at the refugee centers. You'll get less unknown in general. But aside from information, you also need to provide infrastructure for the people on the ground to actually do their job better, faster, and not having to worry about security and not having to worry about the threats that are looming in our day and age. We had built the aid management system in 7 days after the war started, and we already made it available for all the emergency teams at the border. We've managed to build a system in which every piece of resource was being collected in one single system, and everybody who was distributing aid managed to do it effectively from the closest collection center up to exactly where the need was. And then we managed to set up the housing allocation system. We've seen a ton of houses made available on social media. Everybody had an apartment, everybody had a room, everybody had a tent, everybody had an open space for refugees to sleep in. But not everybody was verified. Not everybody had the good intentions, and the human trafficking networks were all over the place. We've designed a system in which the authorities, the UN agencies, and the organizations on the ground could actually access verified houses that had been going through a verification from social services and people who had been tested against police databases just to save time and prevent these kind of human trafficking attempts. The aid management made it efficient to transport resources from point A to point B in a matter of days. The drivers were verified. We knew where every piece of resource is at any moment in time. We trained every single responder. We ensured 24/7 support for every single issue. 4 a.m., 2 a.m., we were there. And yet, I've told you we had so many blind spots that we'll soon be in the dark. While we were busy putting up the most extensive super cybersecurity system to protect the housing allocation platform and to ensure that everything is safe and safe, our UX researcher at the border in an observation visit calls us in and sends us a picture. Somebody had managed to hack the system. They came into the border area with a sticker, with a QR code, and they've put the sticker on top of the governmental poster. So whoever was scanning the government's poster was going to a fake website that was providing housing for refugees. We always need to be ready to hack the system against them. It's so easy to just be fooled, and technology enables more and more creative ways to bring harm. I was telling you about the border, I was telling you about the center, I was telling you about the resources, and then we also had to think about the hospitals at the same time. Not everybody crosses the border as easily as young, healthy people. You had people with cancer, you had people with HIV, you had people with diabetes, people who needed assistance at every step of the way. Do you know what it feels like for a cancer patient to cross the border? Do you know what it feels like for a person living with HIV not having medication 1 day or 2 days or for a week? Do you know what it feels like to go to the gynecologist with a translator in the room? Do you know how it feels like just not to know? It feels super overwhelming. And it's critical to provide access to all this infrastructure. It's critical to provide spaces where people can feel safe to read, to ask, and to talk. And technology can help us that. I'll give you one example. Romania has very few NGOs dealing with people with HIV. The largest one is a 3-person NGO, and the smallest one is a 1-person NGO who works voluntarily half of the time. She assists around 2,000 people every year. When the war started, her patients' number doubled overnight. The technology she used to have at hand at that moment in time was an Excel file. Now she has a complete case manager, helping her manage her work faster and focus on the patients rather than worrying about how fast is she going to get to the last pill box. And we built it flexible enough that allowed us to redeploy it in a few hours for cancer patients, for multiple sclerosis patients, to see at any moment where are the available beds, where are the right specialists, and it was just a mix and match inside a dashboard to connect one person in need with one adequate hospital facility. We scaled in hours for all the chronic patients that were crossing the border. Then school came. Do you know what it takes to mix and match diplomas from one system to another? Do you know what the vaccination scheme looks like for children in Ukraine versus children in Romania? Do you know what it looks like for the ones in Moldova or Hungary? How do you make sure these kids are integrated? Chaos started. Teachers didn't know how to approach these situations. We didn't have enough room in schools. And technology came in and brought together all of these resources to place order in chaos at that moment. Then there's the state, another actor that refugees come into contact with. Of course, you cross the border, but then you start needing things like IDs. You start needing things like paperwork, translations. You need to enroll in programs. You need access to services. 238 pieces of new regulations in 12 days. This is the amount of new ordinances issued by a single government in the first 12 days of the war. All of them addressing either the refugees directly or different entities providing services. Hundreds of pages of legalese that barely made sense to lawyers, clerks, and maybe some few experts. And now imagine you're a refugee. You just crossed the border with your 3-year-old and with your grandmother who can barely read. You have just left everything behind. You're crossing the border. You enter a whole new country. You don't trust anyone, and you don't speak the language. What use does reading an ordinance have for you at that moment? None. And yet it regulates your life as a refugee. So we've connected in the single point of entry a platform with decision trees that helps people understand what they need to do in specific situations. How do I change my driver's license? How do I enroll somebody in a kid? Getting them directly to the answers they need, not skimming through hundreds and hundreds of legal documents. Then there's the job. How do you work in a country that you haven't seen before? How do you stay safe in the workspace? What does harassment look like in a new cultural space? Who's your support mechanism when you have these kind of issues with abuse or harassment or any kind of other trafficking situations? Dangers are everywhere. And then we've built a women's center for it, just to make sure that information gets to these women and that they understand what type of space they're coming into so we can support them. And then there was the mourning, another thing that you need to think of. And not the mourning only for the people who are left behind, the people you lose in the war, but the people you lose while you're a refugee. I'll read you a quote from a field visit in a center. "I have no idea what to do. My father died. Can I bury him here? Back home we had an assigned plot of land for burial. Can I buy one in Romania? Can I move him to Ukraine once the war is over? I think he would have wanted to be buried with the rest of his family. I just have no idea. A lady at the center told me I should cremate him. But I don't know if people do that here, and I really think he would have preferred a burial." This is a quote from a person whose father died while being in a refugee center and waiting for a home to stay in. Life events continue to happen to refugees, either when they're displaced or not. And when you're most vulnerable, understanding what you can do and what the legislation says you can do or cannot do in a completely foreign environment is of highest importance. This is our mission. Our mission is to leave no vulnerable person behind, regardless of how specific or particular or how big or small their needs are. We've taken the mission at Commit Global to unlock this promise of technology for social good and fix the realities on the ground and make sure that we enable information and aid for everybody over there. We identify, we maintain, and bring up to standards critical pieces of civic infrastructure around the world. We train and grow the actors on the ground, and we assist every single NGO to use this technology properly. Because it's not enough to just throw technology at people, you need to have their back in using it. We need to grant access to technology to everyone working with every vulnerable group yesterday. We ran out of time already, and we have to be smart about it. And this launch for us is an open invitation to you all to join our efforts and commit to building the infrastructure we need. Thank you so much.